Score is 12, indicating that she is at high risk for pressure ulcers. Braden score is assessed upon admission and every 60 days when a patient is recertified for care. Some interventions that we have in place are a turning and activity schedule. Skin condition is observed every shift and with all care. Findings are documented in notes. Mia is incontinent and she is checked frequently, at least every 2 hours. I cleanse her skin with soap-free cleansers or non-rinse solution or soap and rinse with water. I pat her skin dry and I do not massage any bony prominences. Moisture barrier cream is applied to protect her skin from incontinence-related breakdown. I change Mia's position in bed every 2 hours, and when she's in her wheelchair, I change her position every hour. I use a draw sheet for repositioning, and this prevents shearing. I use a pressure-reducing mattress or a pressure-reducing overlay on her bed. She has a pressure-relieving device on her wheelchair. Her heels are elevated with a pillow or heel protectors. There is minimal linen under prone skin areas. For example, only one incontinent pad is used at a time. The Northeast Clinical Services Skincare Policy and Procedure. It includes standards of practice guidelines, skincare recommendations, pressure reduction recommendations, and wound management guidelines. Mia has 3 wounds that we are assessing with each shift and measuring and documenting in can time weekly. The first one is an unstageable pressure injury to her left hip. The second, a deep tissue injury to her right hip. The third is a stage 2 pressure ulcer over her right ischium. While I was providing care, I observed 2 new areas of skin breakdown. The first was on her left ischium, and the second was on her intergluteal cleft. Wound, measure length in the direction of the head to foot at the longest point, and measure the width of the wound from side to side at the widest point. We have all sorts of tools for you to use to measure. I like these little sticks. They have a Q-tip at the end and a ruler. We also have these. Measure depth by moistening a Q-tip with normal saline and inserting it into the wound. The first wound we're going to measure is on Mia's left hip. This is an unstageable pressure injury, a full thickness skin and tissue loss in which the extent of tissue damage within the ulcer cannot be confirmed because it is obscured by slough or eschar. If slough or eschar is removed, a stage 3 or stage 4 pressure injury will be revealed. This wound is on Mia's right hip. It is a deep tissue pressure injury. The skin is intact with a localized area of persistent, non-blanchable, deep red discoloration. This injury results from intense or prolonged pressure and shear forces at the bone-muscle interface. This is a stage 2 pressure injury to Mia's right ischium. There's partial thickness loss of skin with exposed dermis. The wound bed is viable, pink, and moist. These injuries commonly result from adverse microclimate and shear on the skin over the pelvis and This is a possible rectal fissure, either a tear from splitting the buttocks or from erosion from stool or urine trapped in the skin fold. This is a stage 1 pressure injury, intact skin with a localized area of non-blanchable erythema. Color changes do not include purple or maroon discoloration. Those may indicate deep tissue pressure injury. When I was assessing Mia, I noticed 2 new areas of skin breakdown. I have to call the doctor, the nutritionist, the responsible party, and my clinical manager.
Hi. Yes, this is Dr. Burton. Mia? Yes. Her date of birth? Okay. How can I help you today? What are you telling me? Wait a minute. She already has 3 wounds. You're telling me she has 2 more? What do you mean? Don't you understand the nurses are responsible? I'm not responsible for this. You see the patient every single day. Nurses own the skin. This is on you. I hear that. I get that. I know there's a lot of nurses in the home. It doesn't matter. What are the nurses' names? I feel like no. You need to get her in. On second thought, I'm going to have my secretary set up a wound clinic visit for her. You can figure out how to get her there. I want her seen immediately. This is not right. Nope. I gave you those orders already. You should have been checking this every hour. Has she been offloading? All right. Well, this isn't right. All right. Thank you. I'm going to be reporting this to the Board of Nursing, and I'm going to be calling your CEO momentarily. Thank you. We'll talk soon. Get me a report, and we'll have her go to the wound clinic. Thank you. Bye.
Hello, this is Mr. Miller. What? You're telling me my wife has 2 new pressure ulcers?
Hi, nurse. Oh, she has 2 pressure ulcers? Oh my goodness. Okay, so have you contacted the doctor to see about staging them? Because we need a medical order for that. So we don't know what stage they are until we get a doctor's order. You need to create a wound assessment form and make sure you take, you have an image, you create the image on the form, and you have to describe it. We'll have to wait, get the doctor on the staging. Also, you would put that on the plan of care, the diagnosis code that goes with the staging. And let's see. So you need to fill out the wound assessment form, make sure that you put measurements in, and also write on the little edit button about what kind of treatment you gave. And if it's improving, and you have to do the wound, check them every week on the wound form. I mean, you can do it more frequently if you want, but try to do it every week. And write something about the wounds in your clinical notes as well. Because you want to make sure that you're describing them so everybody has a sense of whether they're getting better or they're worse. And if they do get worse, you have to notify me as soon as possible, okay? And we'll see if we can heal those up. Okay. Oops, one more thing. Don't forget to get wound orders and put them on the plan of care. Okay, thanks. Bye. Oh, any questions? Oh, you got that. Okay, good. All right, thanks. Bye.
All right, we've done our wound assessments and made the measurements. We've called Mia's doctor, the clinical manager, the responsible party, and the nutritionist. The next step is to put everything into can time. There isn't a lot of talking during this part, so your speaker isn't broken. And I purposely put one of the measurements in wrong, so I want to see if you can spot it. All right, we're on Mia's chart. Go into our schedule for today. To get to the wound form, you can go into forms, or you can scroll down to the skin section and click on wound care. That brings up the wound assessment form. Add new reading is right there. Look at the moving mouse. Now it's time to enter our documentation. This is the wound form, which already includes the 3 areas that we have been measuring weekly. We are going to add a new reading to each one of the wounds. Follow the drop-down options when you're entering the new readings into CanTime. Some of the options aren't applicable for that wound, so you can skip them. No odor. Any drainage? None. 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 Wound edges. Never mind. If the wound has any signs of infection, enter them in this box. This is where we enter the measurements: length times width times depth, and this is all in centimeters. If there's any tunneling or undermining, enter it here. And then describe the surrounding tissue. Next, describe the wound bed. And note if you sent a culture or not. Document the patient's response to the treatment. And this is where you can put wound care notes or any descriptive items that you could not include in the drop-down menu. We'll say diamond-shaped partial thickness skin loss with exposed dermis. Wound bed pink, red, and moist. When you're finished, you can click Save and Close, or you can click Save and add another reading if you're adding multiple readings for different wounds. We're back to the wound assessment subform. We're going to document on site number 2. And site number 2 is the suspected deep tissue injury on Mia's right hip. Add new reading, select the site, and then follow the drop-down options. Don't forget to document if there are any signs of infection. Save your work. Okay, and we're back to the main screen. Now we're going to document on the third wound. Add new reading. Select the site, left hip, enter the stage, and fill in the boxes if they are applicable. We are almost finished documenting on our 3 wounds. Now we're going to add the 2 new areas that we found. One is right there and one is right there. So we click Add New Site, enter the onset date, and a description of the wound's location. Save and add another. Or save and close if there is only one site. And then we save and add another site. Now that our sites are saved, we're going to add the tattoos. The 4th site is the rectal fissure, and the 5th site is the right ischium. Scroll down a little bit, and we're going to press Add New Reading. Select your site, and enter in the data. Erosion at gluteal cleft, wound bed pink, save. Okay. And now we will add a reading for our final site, number 5. We saved it. We're checking our work. All 5 sites are there with our readings. Save and close.